Medicine with our favorite doctor. Take it away.
Yes, that's right. It is time for our weekly health watch with Dr. Syed Hussain of Trinity Health of New England. Good morning, doctor.
Morning. Thanks for having me.
Thank you for joining us.
Yes.
Now, we have quite a bit to get to this morning. First up, we're going to talk about a travel warning the CDC has issued due to measles. So what do folks need to know before they head out on those summer trips?
All right. So long story short, make sure you're vaccinated against measles. It comes as the MMR vaccine, measles, mumps, and rubella. Usually as a child, you may have received the vaccine. It's a 2-dose vaccine. So you make sure that you and your children are vaccinated. The reason why CDC updated their guidance, earlier the guidance was if you're going to an area which is experiencing an outbreak, make sure you get vaccinated. But now it's updated to if you travel, period. And the reason why is because last month there was an international flight that came into Denver in Colorado that led to an outbreak. So far across the country this year alone, we've seen 1,000 confirmed, a little over 1,000 confirmed measles cases. In comparison, last year, all of last year, we had 285.
Wow.
So, and remember, we've regressed as a country. So in 2000, we declared ourselves measles free. But we've seen more and more outbreaks, hence the new guidance, so that everybody is aware that this is a highly, highly contagious disease as well. So it's best to take precautions. It's a very safe and effective vaccine that's available.
Yes. Okay. Definitely protect yourself before you head out this summer. Okay. Up next, a new study found that exercise can improve the survival rate for people with colon cancer. So is that true? And how much exercise are we talking about?
So this is exciting because this is the first randomized control trial actually looking at cancer patients. These are patients who've had treatable colon cancer, who've completed chemotherapy. There are two groups that were studied. One group was randomized to a coach and an exercise program, and the other one was just given reading material on, how to stay healthy and how to exercise, etc. So those individuals that were randomized to the group of actually having a coach for up to 3 years on a monthly basis, going through exercises. And most common exercise that folks did was at least 45 minutes of walking several times a week. And that group showed survival benefit advantage, which is very promising. Now, this comes on the heels of another study that looked at 11 types of cancers, so not just colon cancer or breast cancer, but a wider range of cancers in those folks that have survived cancer, and basically has similar findings of exercise prolonging survival, which is a positive. Because sometimes after chemotherapy, folks can say, okay, I don't feel the energy, I don't feel the motivation, why do I need to do this, that? But this actually should be, a great booster in terms of getting that morale up.
Yes, and this is the perfect time of year to go ahead and get those steps in.
That's right.
Outside. All right, we have one more topic. More home health tests are becoming available, including a cervical cancer test. That was one of the most recent ones, I believe. So what are the pros and cons of having these tests available at home?
Yeah, I'm glad we're discussing this. This is an important topic. So there are two types of tests that folks need to keep in mind. One is where you do the test at home, you put the specimen in a package, and you mail it out to the lab. And the result, you'll find out in a few days. The other test, like a pregnancy test or an HIV test, is you get the results at home. So there are two different types of tests, but one thing that viewers need to keep in mind, please don't take these tests alone in isolation. You need to make sure you are in touch with a provider, a healthcare provider. Because if there is a positive test for any of these screening tests, then it's important that you follow up with next steps with a provider. So things to keep in mind.
Okay, and I think that would probably be beneficial for folks who may not have, access.
For sure. So rural communities, right?
Yeah.
And you may not need to drive 70 miles when you can do a colon cancer test at home. Or if you have, if you belong to a certain community, you have reservations about getting tested, HIV testing, for instance, or syphilis testing in a lab or in a doctor's office, then, those tests can be done at home in privacy. But make sure that you do follow up with a healthcare provider for next steps. That's important.
All right. Thank you so much for joining us,
Sure.
Doc, and we'll see you next week.